Hello, everyone. Thank you for joining us. My name is Melissa Pennell, and I am the Director of Member Engagement at the AMA, and I will be your moderator this afternoon. I'll just take a quick minute to read the AMA's Land Acknowledgement Statement. The AMA respectfully acknowledges that we are privileged to live and work on the traditional lands of diverse, distinctions-based Indigenous peoples, including the Anishinaabe, Dene, Nahiawak Cree, Niitsitape Blackfoot, Otipemisiwak Métis, Sunakota, Stony Nakota, Tsuut'ina, and more. This land has been gifted with many names, including Treaties 6, 7, and 8, the Métis Nation within Alberta, its Otipemisiwak Métis government, the 8 Métis settlements, and its Métis Settlements General Council, and the homeland of the Métis. The AMA honors the vibrant histories, languages, and cultures of the First Nations, Inuit, and Métis peoples of Turtle Island, now known as Settler Canada, who came before us and continue to thrive here today. So as some of you will remember, a few months ago, we gathered some well-known physician experts to talk about measles and to help Albertans to protect themselves and their families. At that time, the government dashboard reported 287 confirmed cases. Now, 10 weeks later, there are over 1,400 cases of measles across Alberta. As the summer unfolds with fairs, festivals, gatherings, there is a heightened risk to children, pregnant women, and immunocompromised people who are vulnerable to the devastating consequences of this disease. Today, the AMA has reconvened its expert panel to evaluate the current situation and to answer some of the common questions physicians are hearing from patients, especially as the back-to-school season approaches. So I'll now introduce you to our panelists. Each one will speak for a few minutes and then we'll move to Q&A. So we'll get going by turning it over to pediatrician Dr. Tehseen Ladha, followed by infectious disease specialist Dr. Lynora Saxinger, and ending with public health physician and former Chief Medical Officer of Health, Dr. James Talbot. Dr. Ladha, over to you.
Thank you, Melissa. So we've been hearing in the media accurately about how Alberta has become the measles capital of North America and has the highest number of measles cases per capita on the continent. And amongst this news, I've had friends and family approach me with specific questions that I'd like to share the answers to because I think that they're questions likely that many people are wondering about. And one of the first things that I've heard people approach me with is, is this measles thing really a big deal? Well, the answer is a resounding yes. There's this misconception that measles is a routine illness, a routine childhood illness, and it's not. Its high contagiousness and relatively high rate of complications and hospitalizations make it unique and something that we should really strive to protect against. It's one of the most contagious viruses on Earth, and children, pregnant women, and immunocompromised people are amongst the groups most vulnerable to it. So in terms of its contagiousness, we know it can spread through the air, and so simply washing our hands is not going to protect us against it. A well-fitted mask may protect us against it. And we know it can linger in the air for up to 2 hours after an infected person is in the room. And so really, if you're in the room with an infected person and you're non-immune, your chances of getting measles is very, very high. The other thing that's really unfortunate about measles is that it's contagious 4 days before the rash appears. So many people are out and about with measles with their children who may have measles and not know it, and have already inadvertently infected many other children. So it's important to remember what I call the R's when you're thinking of measles symptoms. So your child might have a fever and a cough, but if they also have redness of the eyes and runny nose, think about measles before that third R, the rash, appears, and be careful about going out and contact your physician. So as I mentioned, contagiousness is one of the reasons why measles is unique and why it is a big deal. And the other reason is that the complications can be severe and life-threatening. And these can include hospitalization and brain damage. So how do we protect against it? So we've talked about this before, but getting the vaccine is the best way to protect against getting measles. The measles vaccine is safe and it's effective. So 1 dose confers 90% protection and 2 doses close to 100% protection. And yes, the measles vaccine does have side effects, but it's really important to weigh the risk-benefit profile of getting the vaccine versus getting measles itself. So one of the most common side effects of the measles vaccine would be soreness at the injection site. And other side effects include things like fever, with a few percent getting a rash as well. Many studies have debunked the myth that the measles vaccine causes autism. I want to talk a little bit more in detail about the side effects of the measles vaccine here so that it's very clear what can happen and at what frequency. So fever-associated seizures can occur in one out of 3 to 4,000 individuals. And febrile seizures, as we call them in children, are generally benign. They occur, they look scary, they don't usually require hospitalization, and the children recover completely. We need to compare that risk to the 1 in 10 or 10% risk of being hospitalized if someone gets measles itself. So much higher risk. There's also another very rare side effect of the vaccine. Less than 1 in a million have been reported to have brain inflammation or encephalitis with the measles vaccine. Again, we need to compare that to the measles illness itself, which causes brain inflammation or encephalitis in 1 in 1,000 individuals. So if we're looking at the risk-benefit profile, we can really see that the risks of getting the illness are much worse and more frequent than the risk of getting the vaccine. The second question that I've been approached about by family and friends with young children is, should we get our 6-month-old an early dose of the MMR vaccine? Yes, you should. So children between 6 to 11 months have the highest risk of complications, followed by kids under the age of 5. And currently 6 to 11-month-olds are eligible for the vaccine in Alberta in the North, Central, and South regions, free of charge. But I encourage parents with children in this age group to advocate for their child to receive the dose early because they are the most vulnerable, because measles is so contagious, and because, of course, although there are areas of the province with higher rates of measles, people travel within the province. There are no borders, and we are approaching a school start in which there will be many siblings and playmates bringing measles home to their younger sisters and brothers. So really encourage you to contact your local public health office about this and advocate for getting an early dose. An early dose between 6 to 11 months has been proven to be safe as well and is effective. It provides about 80 to 85% protection against measles. Those kids will still need 2 doses of the measles vaccine after 12 months of age in order to get to that close to 100% protection. So I just want to summarize by saying that measles is highly contagious. It has a relatively high rate of serious side effects, complications, a 10% risk of hospitalizations, which is what we have been seeing in Alberta. So yes, it is a big deal. We need to protect against it, and the measles vaccine is the best way to do that. Thank you. I'll pass it over to Dr. Lynora Saxinger.
Thanks very much. So Dr. Ladha went over a lot of the issues in children. I just want to touch on a couple of adult topics. We, have already established that measles is a whole body infection that can have severe consequences, and adults actually have around the same hospitalization rate of about 1 in 10. Adults can have severe pneumonia and hepatitis and encephalitis as well. And I wanted to spend a little bit of time talking about adults who are undervaccinated, unvaccinated, or can't be vaccinated. So if people were born in the 70s, 80s, and early 90s, and if I only had 1 dose of MMR vaccine, they would be eligible for a booster dose. And actually, those age ranges might have a little bit higher number of people who are susceptible to measles. So it is worth checking your immunization records and getting a dose if you're eligible. Some people cannot get the vaccine. And so women who are pregnant are not advised to get the vaccine because it's a live vaccine. And so it is really best to make sure that you're immune before becoming pregnant. And it is still worthwhile getting your booster after you are pregnant as well, just because it looks like measles is going to be around for the foreseeable future, and that would be a wise thing to do. For people who are immunocompromised, some types of immunocompromise also make you not eligible for this vaccine. That's kind of a case-by-case decision with your specialist to some extent. But we know that people who are on cancer chemotherapy, people who have had transplants, people who have blood and lymph node type cancers, and some other treatments that can be used for immunocompromised people do have a higher risk of complications of measles. I would point out that all of those treatments that, basically leave you with a potentially weakened immune system and yet extend and improve your life are things that have happened over the past 20 to 30 years while measles has not been around. So there's not a tremendous amount of data of the complications of measles in these settings, but what there is non-reassuring, with some studies showing, 50% hospitalization rate for immunocompromised people getting measles. So how to protect people who are immunocompromised or cannot be vaccinated during pregnancy, or what can people do for themselves? I think that, the first thing is to think about exposure. In some zones right now, basically existing in the zone is considered essentially an exposure, but that's a little bit unrefined. And you have to think about group dynamics, where if you're collecting with a group of people and it is likely that a number of them are under vaccinated, that would be considered a riskier scenario. And you might want to, assess carefully anytime you're going to something, whether or not there might be risk in that setting. If you are in contact with people who are a direct contact to measles, that would also be considered higher risk. And the thing that is important to know is that for some of these people who cannot be vaccinated, the management can include getting intravenous immune globulin to protect you. And so for pregnant women who are exposed, and for some immunocompromised people who are exposed, it is important to reach out and find out if you're eligible for this treatment to reduce the risk of severe consequences. Aside from those things, I would also say that anyone who's at risk should make sure that their inner circle is up to date on their vaccines and have had 2 doses, because that can actually provide protection as well if the people that you most commonly associated with are protected. And finally, although there's not a lot of data on how effective it is, we certainly do it in hospital, and it's something that you can do in the community, which is mask. So if you're going into especially enclosed indoor space with other people, an N95 mask should reduce the risk of measles, and it would be something that would be an option for people to consider doing if they're going out, if they're pregnant or if they're immune compromised. I'm also going to point out that there's no specific treatment for measles, but if you are very ill, you should be seen, tested, and potentially would require supportive care in hospital. So receiving oxygen, symptom relief medication, and also looking out for secondary infections. And then the last thing I wanted to touch on a little bit was disinformation and the resurgence of other vaccine preventable illnesses. I think it's very reasonable to say that disinformation is a major factor contributing to measles outbreaks worldwide right now. It also is behind some of the lower uptake of other childhood vaccines that we've been seeing. And the current vaccination rates in many places in Alberta and across Canada are below the level required to prevent transmission of the disease if it's introduced in the community. And it leaves our communities vulnerable to measles and other vaccine preventable diseases. And we know that these are very significant illnesses. Many people will get them and recover, but others can have bad consequences, such as fatal pertussis, which is whooping cough in babies, stillbirths and birth defects from rubella infection in pregnancy, infertility in males after having mumps infection. And these consequences are avoidable with things that we have known to be safe and effective long-term with the vaccines. So it's predictable that measles would be the first of these to show up because it's the most contagious, but we might expect these others could be on the heels of measles. And we do have a window here to reduce the risk of other vaccine preventable diseases by helping Albertans detect disinformation coming from misled conspiracists and influencers who profit from vaccine hesitancy. And I really would like to see a strong public health campaign centered on reliable evidence-based information to help address the issues of trust and anti-vaccine narratives, because these are actually putting people's health and their lives at risk. So that is it for my section. I will turn it over to Dr. Talbot.
Thank you, Dr. Saxinger. So I'm here to do the public health update for where we are with measles in the province of Alberta. The numbers were just updated yesterday. So measles is continuing to spread with 31 new cases coming from all 5 regions since the last update, with the largest number of new cases in the north and now in Calgary. The regional percentages of unimmunized children below the age of 2, that group that is most at risk for serious complications, range from 20 to 50%. So measles in the province and still a large number of vulnerable kids. The government is reluctant to call this an epidemic, but when Alberta's 1,400 cases are larger than the number for the entire United States, and we have 12 times the number of active cases as Texas does per capita, there's no doubt that this is an epidemic. Worse, there can be no doubt that it's still not under control. The government has taken some steps to increase immunization rates to prevent the spread of measles, and every one of those immunizations is important. They have expanded immunization access for infants between the ages of 6 to 11 months in the south, central, and north zones. They've opened a measles hotline so that Albertans can access their immunization records and book appointments, and they've launched the Don't Get Measles, Get Immunized campaign across the province. Public health teams are also targeting outreach in under-immunized communities to boost their uptake. But as the measles numbers show, these measures are not enough. In particular, it is clear that in a provincial epidemic, every child between the ages of 6 and 11 months deserves access to the vaccine, including those children in Calgary and Edmonton. It makes no sense to only protect those in rural areas. So what are the most important actions you should take today? Well, considering that in September, children will be going back to overcrowded schools after having attended family gatherings, baseball tournaments, Bible camps, and a host of other group activities, some will have been exposed to measles. And in Alberta, students returning to school are not required to show proof of immunization. So we can expect that measles transmission will occur in schools and that the numbers are going to increase. That represents a perfect storm where our children, grandchildren, nephews and nieces, and family members will be at risk, increased risk in getting measles because they've gone to school in September or because they brought it home from school to infect the children who are still at home. So you need to book your appointment now. It takes time to book an appointment, and then the child's body needs 10 to 15 days to get to maximum protection. So book your appointment now for anyone going back to school and anyone under the age of 5 who's not immune in your household. That's the most important back to school preparation you can do, even more than buying a backpack or a lunch box. Making sure your children are immunized will accomplish 4 things. It will ensure that they do not get measles, they do not get hospitalized, they do not go deaf or worse. It will give you the peace of mind that no matter what other people have done or failed to do, your child is safe. It will make your family and your community safer. And finally, it means that you will be able to say that you know the science and you've been smart in protecting your child. Maybe not smart enough to get you on jeopardy, but smart enough to show that you know what's important to the health of your children. Because Indigenous children are also at high risk and often in remote locations, we urge Indigenous parents, leaders, and elders to continue to advocate to ensure your children do not fall into the cracks between provincial and federal jurisdictions for immunization. If wait times to get the vaccine are unacceptable to you, phone or write your MLA and the Minister of Health so that government can get the resources needed to your area to decrease those wait times. And finally, as already been mentioned, There are at-risk populations that need to check their status and get immunized if they don't have full immunity. That includes healthcare workers who are likely to be exposed as the cases increase in September, and young women, particularly those who are considering getting pregnant. So, for instance, elementary school teachers who would be teaching a group at particular risk need to seriously look at their immune status and ensure that they're immune before they start their families. So the bottom line is that measles is spreading throughout the province. It's now significantly moved into Calgary and the north, and you need to make sure that your children, particularly those under the age of 5, get immunized, and the best time to do it is now. Don't wait for the start of the school year. Do it now so they're protected when the school year starts. Thank you.
Thank you, Dr. Talbot. So we'll move now to Q&A. If you've got a question, please go ahead and just use the hand raise button. We'll go in the order of hands raised. When I call your name, just come off of mute to ask your question, but do please remember to introduce yourself and let us know what media outlet you're with. And if you'd like to direct your question to somebody specific, just please also let us know that. So it looks like first up we have Jen Lee. Jen, please go ahead.
Hi guys, thanks for taking my question. It looks to me like the weekly case counts in Alberta seem to be, rising more quickly. I guess I wonder what you think is driving that. And Dr. Talbot, you alluded to what we're seeing in Calgary in terms of cases starting to tick up here. What's your level of concern about all of that, and where do you see this going, like even before we head back to school?
Well, you mentioned me, so I'll go first. My level of concern is very high, and Calgary is at the top of that, and the North are at the top of that level of concern. Calgary has amongst the better immunization rates in this age group, but it's well below the 95% that's required for protection. So it's more in the vicinity of 75%, which means it's 5 times the level that we would like it to be to protect Calgary children. The number of cases in the north is accelerating rapidly, and we're concerned about groups in the north who may be isolated, who may not have access to the health care as quickly as they might need it if complications develop. And then, as we've already mentioned several times, to go back to Calgary, we're concerned about this failure to protect 6-month to 11-month-olds, which is inexplicable given how widespread measles is. In terms of what's driving it, I mean, it's absolutely clear that the province has not done enough to bring it under control, and so it continues to smolder. If you use a forest fire as a metaphor, there's lots of kindling out there, which is the unimmunized, to allow that smoldering to continue. And then the equivalent of hot weather is all the various activities that happen in this summer, which are obviously very positive and very important to our health, but which have provided the perfect storm for increasing the chances of transmission. So if you're at Bible camp, or you're at a baseball tournament, or you have a family gathering with people from all across the prairies coming to join you, that provides an opportunity for one of the most transmissible viruses on the planet to cause more cases.
Thank you. Next up, we have Jackie. Jackie, please go ahead.
Thank you for taking my question. I guess my first question is, are there other places in Canada where immunizations are required for public school? I mean, is Alberta off trend in that? Seems to me, if I recall correctly, there are places in the States where you have to have your immunizations in order to go to public school.
There are in the United States. There are also ones in Canada. Ontario, for instance, requires proof of immunization for reentry to school. So Alberta is, it may not be alone, but it is, given the number that Ontario and Alberta are where the vast majority of measles activity is happening. Ontario is better situated for September back to school than Alberta is.
Do you think the province should reconsider its position on that then?
I do. I think it may need to be a public debate, but I think there are two ways in which we need to have discussion. The first is whether or not the policy should be changed globally, and the second is to make sure that people are aware that if measles does strike a school and starts to spread, that it may be necessary to send unimmunized students and unimmunized staff home so that they are protected for the time until all of those people who have been exposed are safe to return. So there are two levels at which we need to look very seriously at creating a wall to protect our schools. And the other point I just want to mention, because we touched on it briefly, is that I understand there are concerns from young female teachers, some of whom may not be fully immunized, about what's going to happen to them if they're pregnant during the school year. And so I think the province also needs to look at their policies for that. Lynora, I know you have significant expertise in this area. Is there anything you wanted to add or correct?
Not necessarily. I mean, I think that the vaccination policy question is important, and I appreciate that you brought up the issue of, basically quarantining exposed individuals, because a lot of people might not have thought through the implications of that. Because measles has a really long incubation period after you're exposed, to avoid exposing others while you are developing your own measles, if you're not immune, you really are meant to be quarantined for 21 days. I believe is the current guidance. And that is a long time. And that's for people who are not sick. That's to try to contain the infection and reduce the successive rings of spread. And that's very disruptive. If you think about that occurring in a school year and a workplace, it is a really strong practical argument to make sure that your immunization is up to date and the immunization of your children is up to date.
Thank you.
Okay.
Oh.
Oh, can I have another question, or are we taking turns?
I think we're taking turns, Jackie. Sorry. We'll move on to Felix. If we can come back to you, we will.
Yeah.
Felix, please go ahead.
Hello, I'm Felix from Radio Canada. We're at over 1,000 cases now, halfway to 2,000. What's to expect now in terms of complications?
I can comment that I think that we've been lucky so far and that we haven't seen severe outcomes. There's been a number of hospitalizations, mostly in the zones that have had the greatest number of cases. There's been some ICU admissions with people requiring care. I have been, just recently being called about more pregnant women who have measles in pregnancy. I've also been called about transplant patients with measles. And so the likelihood that there will be severe outcomes, with really significant critical illness or death is just going up, because the longer we have circulation of disease and the more cases that happen, that's basically just a matter of numbers and risk. And it's just a matter of time, unfortunately. I'd be very happy to be wrong on that.
Mm-hmm. Yeah.
And in the last 10 weeks, have we switched from like a prevention mode to damage control, or more of a damage control?
Well, I mean, I think it's a sign that when the zones basically stop posting the areas of exposure, like people were looking to see, and you'll often see, individuals have traveled from their doctor's office to a laboratory, to a radiology site, to, the mall, somewhere in between. We don't see that from those sites anymore, because the volume is simply too high for them to be able to catch up. And so we just know that there's more transmission and more cases than are even being detected. And we're probably seeing, to some extent, the tip of the iceberg on the hospital side.
Yeah. Thank you very much.
Thank you.
Just to add a little bit to what Lynora was saying, for more than about 20 years in Canada, we have had importations of measles, but the system was protected by a public health system that was able to devote enough resources to making sure that cases and their contacts were isolated and quarantined to bring it under control. And there were fewer of those to look out for because the immunization rates were so high. What we're seeing in the last 10 weeks is that first line of defense is being overwhelmed. That's exactly what Lynora was describing. And now, as a consequence of that, the fact that we don't have enough immunizations to stop the spread is a major concern. And so the two strategies going forward are to try to get those overall numbers up and protect the most vulnerable. So yes, we have seen a change in the last 10 weeks.
Mhm. Devika, you're up next. So before you ask your question, we are at 2:30. Can I ask our panelists if we're okay to stay on for 5 extra minutes? If that's okay. We just got a few hands still raised. Okay, Devika, please go ahead.
Thanks so much. Hi, Devika with the Calgary Herald. Thank you for taking my questions. So this question, well, could be for everyone, but Dr. Talbot, you had mentioned that, what we're seeing over here is an epidemic, even though the government has not called it as such. Could you just comment on what is the significance of calling what we're seeing here an epidemic from a public response perspective? Do we anticipate, a change in public response if we were to label it as such?
I think that in the public's mind, the epidemic brings a level of urgency that is really important when you're asking people to take time out of busy schedules and take time off vacation to make sure that their children are immunized and do the right thing. So that it's important for the public. I think it's all important also because then you would expect to see the chief medical officer of health doing something like weekly or biweekly updates. You wouldn't be coming to us to get the information on how many new cases there are. And more importantly, they would be giving the progress reports for what percentage now of the kids under the age of 2 are immunized and how many of the 6 to 11-month-olds have been immunized. And finally, some kind of rationale for why Edmonton and Calgary 6 to 11 months old aren't getting access to the vaccine that would keep them safe. And so I can't speak to why the government is shying away from this term, but the practical effects would be to increase the level of concern appropriately for the public so that they can protect themselves and the people that they care about. And secondly, to be able to make clear that the government is taking this seriously and are accountable for the resources that need to be deployed to bring this under control, which, as I pointed out, it is still not under control.
Mhm. And perhaps, sorry, can I ask another question?
Yeah, quickly.
Sure. Yeah. Perhaps you've already kind of answered this in part, but you've already said that the province isn't doing enough to kind of mitigate this this epidemic. What else should the province be doing?
Well, as I said, I mean, I think having the chief MOH report on this regularly, giving people progress reports so that they can be aware of and get positive reinforcement that they're doing the right thing. They need to announce as soon as possible that the vaccine is now available in Edmonton and Calgary for children between the ages of 6 and 11 months. I think they need to be able to explain to the public what extra resources they've deployed and where they've deployed them and what they're being used for to get the immunization rates up and to bring the transmission chains down. And then, as we've already said, there are questions around educational policy that they need to be accountable for as well.
Thank you.
I think we've got time for just 2 more, if that's all right. Tina, please go ahead.
Hi, I'm with the Daily Herald Tribune in Grand Prairie. Dr. Talbot, if you were to choose one, what would you say the number one hindrance or threat to preventing further spread I mean, we're not going to stop it at this point, but to preventing further spread to some degree? What would you say that is?
Well, first of all, I'm not a defeatist and I wouldn't be in public health if I was a pessimist. So we can bring this under control. Other jurisdictions are, and BC and Saskatchewan have not gotten to the place that we are, even though they have Alberta as a continuing source of new case exposures. So I'm not prepared to accept that we can't bring it under control. I think the single biggest hindrance I have, and many of the people on this call and others in the province who are both medical and scientific experts, have said that the government is not taking this with the degree of seriousness that it deserves. And I also think that the government as attitude towards immunization is significantly less supportive than it should be. And the immunization campaign that they announced, I've checked with friends and family, and the majority of them are not aware that it's going on. So that to me is the biggest hindrance. I think the number of people who are actively promoting misinformation is relatively small. They're important, and we need to have ways to combat them. But I would put them in second place.
Thank you very much.
Thank you. And last question to Lisa. Lisa, please go ahead.
Thank you very much. How do you think we got here? Thinking back to say 30, 40 years ago, there wasn't as much misinformation, but there also wasn't as much technology to really get these messages to people. But it was almost just the thing you did get, the measles vaccine. Whereas now, out of the pandemic, there's a lot of anti-vaxxers and negative connotation on vaccines from COVID. So what do you think the issue is here and why it's such a problem at this stage in the game?
I can take a stab at that one. Because I have a bit of a scholarly interest in disinformation, but I mean, you alluded to a lot of it already. We actually now have a population that doesn't have a single source of truth. People get their information from a wide variety of customized streams that are customized by algorithms that are not driven by the public good. And as a result, fringe elements have ended up taking a very central voice in messaging around matters that actually pertain to science and health. And the science and health people have not necessarily been there battling that because, frankly, we're over here doing our thing. And I think that we were outflanked and outgunned in terms of the information availability. And the fact is also that we're in a post-truth era where, if people say things loud enough and often enough, it assumes a semblance of truth in a lot of the public's eye, even if it has absolutely nothing to do with the evidence. Or the actual observable truth. And so it's a very difficult and different environment that I don't think has really been, we haven't adjusted to that necessarily on the side of medicine, science, and public health. And it is really, really difficult to battle it back after a certain amount of disinformation has become so solidly enshrined. And people don't even have to believe all of it. They just have to see something frequently enough that they have doubt, and that doubt will prevent them from booking their vaccine shot. So they're not all necessarily established anti-science, non-trusting individuals. They're just people who have enough doubt that it changes their actions. And that is a really difficult position, I think. And so, doing things like this is a gesture towards those individuals saying, what, you've been seeing things that are, potentially very untrue. And, we have to establish that culture of trust again. And I'm not sure that we've really had a concerted effort to be able to do that. And I think it does actually have to have some resources put to it on a government and public health side.
Yeah. On the note,
Sorry, I would add one short thing to that, which is, and I hate to be as the guy who's in his 70s referring back to the past, but one of the other things that we need to figure out a way to make more clear to people is that when I was growing up, I had cousins who had polio. And I remember them running around the base paths with braces on because their legs and the muscles were so shrunken from the disease. There were still people that I trained with who remembered handbagging people who had polio who were in respiratory failure because there weren't enough iron lungs to go around. There were people who trained me who had seen babies with brain damage because they coughed so hard from whooping cough that they actually cause what we would call concussion or brain damage just from the brain sloshing back and forth during whooping cough. Um, uh, there were, and so there were just a lot of people who knew, just ordinary people, mums, who knew that measles, even if you didn't end up with a child who ended up in the hospital, or you didn't end up with a child who was going to the Alberta School for the Deaf to learn sign language, that measles made their children miserable for the amount of time that they had it. And they would do anything to keep from that from happening again. And we have turned our back on, we don't need a conspiracy theory. There are a lot of organisms out there, and they're still out there, that want us and our children dead. And and we have the tools to keep them at bay. And if we allow them to come back and children die as a consequence, then that's on us because it doesn't have to be that way.
Thank you very much.
Yeah,
And my
oh.
last question would be, do you feel, I guess, how would you respond if you were in government? I mean, do you think they're in a rock and a hard place where this is a society we live in, that if they do put mandatory vaccinations in, we saw the uproar from COVID. Do you find now it's just a really tough position to be in, or do you think that's an excuse?
More than 90% of Albertans got at least one dose of the COVID vaccine, and a significant number, I think it was in the 70s, got two. I don't think that amongst regular Albertans that there is much doubt that vaccines and immunization are important. Right. So if the government was just going on the basis of the number of votes that regular Albertans have at their disposal, I don't see this as a difficult choice. Every study indicates that the number of people who believe the misinformation enough to propagate it are relatively small and not enough to get you elected in any riding in Alberta. So I'm not a political expert, but I must say I don't understand the math.
Okay, I think we'll leave it there. And thank you so much to our panelists for staying on a few minutes longer. This is a really important conversation. And thank you all for joining us today. As always, if there's any follow-up, please just reach out to media@albertadoctors.org. Thanks again and have a great day.